If you have been having recurrent miscarriages, okay, and probably you've given birth before, or you had an abortion one time ago and now you want to conceive, it's not possible, and you've been having your current miscarriages, I think you should try to check out your rhesus factor compatibility. Don't worry, I'm going to come down. In this video, I'm going to be explaining to you the 5 or 6 causes of miscarriages and how to avoid and how to deal with it. So this one is one of the most important reasons. So that's why it's coming fast. Now, this is called rhesus factor incompatibility. This happens when the mother's rhesus factor is incompatible with the baby's rhesus factor. How this happens is when the mother is rhesus factor negative, the child is in the womb is rhesus factor positive. Now, and the mother has been sensitized or the mother has been exposed before. I will explain what that means. Okay, what it means is maybe there was a time you were pregnant before, or you aborted the baby, or you successfully delivered the baby, nothing happened. So that time you were negative and your baby was positive. Your blood and your baby's blood mixed together. This is called sensitization. The first time nothing will happen. It might even be you had an abortion. It might be during blood transfusion. But once rhesus factor positive and negative comes together, you've been sensitized. So next time when your blood meets another, that's your blood that is negative, meets another blood that is positive, which is your baby, it will try to kill, it will see that your baby as a foreign object trying to attack you. So what it does, it will kill the baby. It will be destroying the red blood cells of the baby until the baby dies. This is what is going to be happening steady. You know, people think that this is witchcraft or they are being manipulated, or this is science. Okay, so what happens now is when you notice, this is why before you get married, these are the things you find out, you know, before you get married, or when you're pregnant, you go to a reputable hospital. Okay, they usually do this test. Most people do it. So when you're rhesus negative, what you do is they give you a vaccine, like a vaccine is immunoglobulin, rhesus factor immunoglobulin, okay, that will not make this thing happen. But however, if you have been exposed already, okay, if you've been exposed already, there's not, it's like you being HIV positive now, and they're giving you a HIV drug that will, you know, it's not going to work, it's just going to bring it down. Okay, so if you've been exposed before, the drug will not work. What they will do is you have to be monitored. Your pregnancy will have to be monitored. The doctor's eyes will be on you. Even you might even be admitted. When something is fishy is about happening, they can rescue the baby even before your time, your term for pregnancy, which is okay. So this is what it means. Your blood and your baby's blood are not compatible. So your blood is killing your baby's blood and the baby will not survive. Okay, so if you're having your current abortion miscarriages, try to find out if this is the cause. Okay, now number 2, this one is very, very important. Previous intentional abortions. You have abortion intentionally, took the drugs, and you've been having it recurrently. This makes your service to be incompetent. Okay, not in all cases, but I remember I'm going to be giving you 7 causes of miscarriages. Okay, so if you've been having abortions before intentionally, or the one taking drugs, you know, when the baby wants to form, you don't allow it to form, you take it out, you know, your service might become incompetent. It cannot, some people, it might not hold a baby, you know, once something is coming, it flushes out, and even your hormones are not even balanced, and you know. The next one is improper implantation. Okay, this is where you hear the cases of ectopic pregnancy. Now, the pregnancy or the egg didn't attach in the place it's supposed to attach. It's attached in other parts of your reproductive organ, probably fallopian tubes, and you know, so this will cause injury. Now, another one is trauma and injuries. Okay, people that are pregnant, most people tend to, you have to, you know, relax and tame your pregnancy, take care of yourself and your baby. So most bodies are different. So if you notice you've been having recurrent miscarriages, try to, be calm, have a good rest, avoid trauma, avoid injury, psychologically and emotionally. Another one is causes of miscarriages, consumption of illegal drugs. Yes, even alcohol. Most people, when you end up giving birth to that baby, you will see that the baby will have alcoholic birth syndrome. The child will alcoholic withdrawal syndrome. The child will start, a lot of things will happen during when you give birth to that baby. So this can also prevent you terminate the child too. Some drugs, some hard drugs, okay, can terminate the baby. So be careful on the kind of drugs you take, even herbal remedies you take. Most people take in, they don't even know that they have taken in, and they continue taking drugs that they feel will help them to take in, and this thing will end up flushing the baby. Okay, now another one is genetic disorder, right? There's some people that genetically just happens to them. They just get pregnant and it goes. Find out, you have to go to your host doctor. They will have to find out what is going on and how to salvage this. Now, the next one is age. Well, women that are, from 18 to before, women that before 35 years, they tend to have lesser pregnancy complication than women from 35 years upwards. They have more, apart from, God is the ultimate. If he says you come out successfully, you will come out successfully, but this is based on statistics. Women that are 35 years older find it difficult to have a successful pregnancy, and their pregnancy usually lasts in abortion, in miscarriages. However, of course, there are women that give birth 40, 50 years. It all depends, but these are the causes, right? Now, another causes of miscarriages is smoking, antibiotics. So you have to be careful on the kind of antibiotics that you take. So smoking, antibiotics, malnutrition, you're not eating well, environmental factors such as these pesticides that we use. Okay, you be careful on inhaling them. Even the smoking, you have to be careful on inhaling secondary smoke. So you will not just stay and say you're not smoking, meanwhile somebody is smoking by your side. You are in the club, you're smoking, somebody is smoking by yourself, you are still smoking. So you have to be careful. Okay, also taking caffeine. So if you're pregnant, limit your caffeine or coffee, especially if you're having abortion. So try to limit your caffeine, right? So these are the 8 causes of abortion, miscarriages. However, there is another one, hormonal imbalance, of course, related to polycystic ovarian syndrome. People with PCOS, your hormones is not, the actual hormones that supports pregnancy is low. So when you've noticed one time that you've had you've had abortion, miscarriage, what you do is to go, and once immediately you take in, of course, you have to work hand in hand with your doctor. Once you take in, your doctor knows, he gives you drugs to support the pregnancy, support the hormones to support your pregnancy, so that you don't abort it. And some people that have cervical incompetence, those people that, because of previous abortions and some other things they've been doing, their womb can no longer hold a baby. There's what is called cervical sacrilege. Once you take in, there is a month they will tie your cervix so that it will hold the baby. When you're about to give birth, they will untie it. It's a surgical procedure. Okay, so let me know, like this video, share, let me know if you have more questions, and be careful. You will soon carry your baby, don't worry.